Up next, I will introduce Rebecca Vidak, who is the supervisor of clinical quality management within Highmark Whole Care's special needs unit, and she is the EPSDT coordinator. So I will just pass it right on to Rebecca.
Good afternoon, everyone. Welcome to our policy panel. I'm joined today by 4 policy experts who will be talking about the current state of lead poisoning prevention policy at the local, state, and federal levels. There will be time for audience questions, so feel free to drop them in the Q&A, and we will address them at the end. Before we jump into our conversation, let me introduce our panelists. We have with us today Amanda Reddy, who is the executive director of the National Center for Healthy Housing, an organization founded on the premise that being better housing can be a powerful platform for better health. We also have Colleen McCauley, the health policy director at Children First, the Greater Philadelphia region's leading child advocacy organization. Julian Gonzalez serves as the Senior Legislative Counsel for Earthjustice's Healthy Communities team in Washington, D.C., where he is the lead lobbyist on water policy. And Erica Strasburger, a member of Pittsburgh City Council serving District 8, which includes Pittsburgh's Oakland, Shadyside, Squirrel Hill, and Point Breeze neighborhoods. Welcome, everyone. Amanda, the current administration has been really focused on infrastructure. They've even been to Pittsburgh multiple times in the past year to highlight the progress and challenges we've made in improving infrastructure, including lead pipe replacement. Can you talk about the Biden administration's focus on infrastructure and, in particular, their lead paint and pipe action plan, and what it means for progress in preventing lead poisoning?
Sure. I think first and foremost, it's really important to acknowledge that it is always helpful when there is a clear commitment from the federal level to eliminate lead exposure and lead poisoning. We saw that with the major gains 30 years ago with the enactment of Title 10, our nation's main lead law, and 20 years ago with the 2000 presidential task force. And over the last couple of years, more recently, it's been especially important to hear HUD Secretary Marcia Fudge, make the case so strongly and so compellingly that housing is infrastructure. And, I know that we at NCHH were so hopeful, along with so many of you here today, that Congress and the administration would use that as an opportunity to invest in preventing lead exposure and improving housing quality for other outcomes as well, more holistically and more generally. And, unfortunately, that didn't happen. But the $15 billion that the infrastructure bill did commit for lead service line replacement, which was about a third of the funding that was requested by advocates, is still a really significant, historic, and welcome investment. And, I have to say, I'm very encouraged by, how many conversations I've been seeing at the state and federal levels and with water utilities and the water sector about how to ensure that funding is implemented effectively and equitably, which I think will be the real test of that investment. And similarly, you mentioned the Biden-Harris lead paint and pipe action plan, which was released last December. And that's also a commitment worth applauding and a really good starting point for action, but only if the administration and Congress and leaders at the federal, state, and local level, to be quite honest, don't stop there and really see it as just a starting point. The plan's name, the Paint and Pipe Action Plan, suggests what we all are working towards, right? This more comprehensive and holistic approach to eliminating lead exposure. But the priorities and the funding outlined in the plan, which included, new action in the revised lead and copper rule, the new funding from the infrastructure bill for lead service line replacement, and then just an articulation of a lot of existing policies and programs that have been really important to making progress in addressing other lead exposure, but not any new commitments for action or investment there, sort of fall short, right? It's not enough. So the commitment that plan signals is really extremely important, but the promise of that plan is really only going to be realized if the administration takes steps to build on the programs and the investments it outlined, increasing their investment, for instance, in eliminating hazards from lead-based paint, which is still the most significant source of lead exposure for most communities, including, I believe, the most significant source of lead exposure in Allegheny County, fully funding lead service line replacement and banning partial replacements, which we know are so harmful, removing barriers to testing and remediation, including revising disclosure requirements, increasing the enforcement of provisions that are already on the books, like our renovation, repair, and painting rule at EPA, which we know returns an estimated $3 for every dollar invested in enforcing it. Getting lead, doing more work to get lead out of food and other consumer products that are intended for children, and much more. And I'm happy, during the course of today's panel to share a link to a blog post I wrote in the days following the plan, sharing NCHH's take on how that plan could be strengthened. And, although you didn't mention them specifically, I think it's also worth mentioning and celebrating two other developments at the federal level, including the American Rescue Plan Act and the more recently passed Inflation Reduction Act. We've been seeing communities around the country allocating those Rescue Plan Act funds in innovative ways to address lead exposure, acknowledging, right here in Pittsburgh and Allegheny County, allocating funds to support both lead service line replacement and lead paint hazards, really, providing a really powerful model for other communities around the country to take that more holistic approach. And then, while the Inflation Reduction Act doesn't call out lead specifically, it does note the ability and the promise of investing in co-benefits of improving housing to be more resilient and more healthy. So, and although that uses more of an indoor air quality lens in the language, the specific language of the IRA, there are certainly important opportunities for lead there as well. So there's lots of reason to celebrate. This really is a unique and historic moment, and the investments that have been committed are an important down payment, but I think it's important that we think about them as that down payment, because if we really want to solve lead poisoning, and we can, right? I think we all agree that this is a problem we can solve and that we have a moral and economic imperative to do so. We have to learn from lessons of the past, right? I think we can all imagine, what if in 1978 we hadn't stopped at just banning lead in new residential paint, but had committed to getting lead out of the millions of homes that already had existing lead paint, right? We could have prevented millions of children from being exposed and harmed, and let benefits instead of harm snowball across generations. Or if in 2000, 20 years ago, we had really fully funded all the strategies outlined by that 2000 presidential task force, what kind of impact could we have seen? And, my staff often hears me say, you reflect on that old saying of the best time to plant a tree is 20 years ago. The next best time is now. And I think that's what it's really important for all of us to remember in the room, that we have this opportunity, this moment, to make sure that decision makers at all levels right now, as they're making these investments and making decisions about how to allocate and implement these funds, really commit to finishing the fight this time.
Yes, thank you, Amanda. And Dana did put the link that you had mentioned to your blog in the chat for everyone to reference.
Great, thanks.
Julian, your organization has done a lot of work recently in the revisions that the Trump administration proposed for the federal lead and copper rule, which is the rule that sets the lead action level for pipe replacement and mandates public notice and corrosion control. Can you talk about the shortcomings in the rule and its proposed revisions as it currently stands, and what you'd like to see, especially as it pertains to environmental justice?
Definitely. And first of all, thank you all for having me. I'm really excited about this panel and the whole event that y'all are having, and I'm happy to be a part of it. Okay, with that being said, I'm going to get very, very nerdy for about 5 minutes. So the starting point for the shortcomings of the rule is in the science. There's no safe level of lead. Even a little bit is extremely dangerous. So we start there. Under the Safe Drinking Water Act, the default way to regulate contaminants is what's called an MCL, which stands for a maximum contaminant level. It's very intuitive. It's just the maximum level of a contaminant that's allowed in the water that comes out of your tap for any user in a public system. And that has to be set as close to a level that causes no harm as possible. Like we said, for lead, that level is 0. And if it's higher than 0, there would be a violation. But you don't have to set a system doesn't have to have an MCL in place if it's not feasible economically. So if they can't do that, or they argue that they can't do that, then they have to do what's called a treatment technique, which is a process or a regulatory framework that helps monitor and decide when there's a violation and when action needs to happen. And that's what the lead and copper rule is. They said they can't, EPA said a long time ago in the 90s that they couldn't set an MCL, it's too expensive. So instead they have this very overly complicated, counterproductive, harmful regulation, which is the lead and copper rule. And later the lead and copper rule reforms, which were what was finalized under the Trump administration and what Earthjustice is involved in litigation. So for the lead and copper rule, you're only in violation if you don't follow the process. The actual lead levels don't determine whether you're in violation. That on its face is crazy and just flies in the face of common sense. So for the lead and copper rule, there's a threshold which is called the lead action level, which Rebecca mentioned, which is 15 parts per billion. And remember, 1 part per billion is harmful. So 15 parts per billion is the threshold where stuff happens, maybe, under the lead and copper rule. Basically, if 10% of the samples taken are over that lead action level, then and only then is there an exceedance. So for a real life analogy, I'm from New York City. In New York City, given the number of people and homes, that means 800,000 homes can have lead levels from 10 to 15 parts per billion, and nothing would be required under the lead and copper rule. They could be in compliance, which is crazy. Further, even in terms of the sampling that is required under the lead and copper rule, you would only in those 800,000 homes have to sample 100 sites, and it would have to be 10% of those 100 sites have to exceed 15 parts per billion. And sampling is a tricky thing for lead in drinking water because there's a lot of variables. It depends what time of day, what kind of house, how you actually take the sample. Are you measuring the 1st liter of water or the 5th liter of water that comes in? Was all the water system flushed before? There's a lot of factors. So the sampling isn't really representative at all. So there's just layers and layers of ineffectiveness to this rule. Say there is an exceedance, right? Say they do find 15% of the homes to have over 15 parts per billion. Then only then corrosion control is required, which is a chemical way to reduce lead in drinking water. And then after that, only after that was tried, is lead service line removal required, which is, as we know from studies, the most effective way to reduce lead in drinking water. And even then, the original lead and copper rule required only a 7% replacement rate of lines every year, and the reforms lowered that to 3%. So this is like an onion of ineffectiveness. Just every time you learn more about the rule, there's just more nonsense in there. And what we really need from EPA is to understand that we don't need tweaks to that framework. The whole thing is flawed. It's a house of cards. We need a transformative, brand new rule, ideally a maximum contaminant level, but if not that, then a more stringent lead action level, right? Canada and the European Union and tons of health organizations say 5 parts per billion is much more protective. We need a mandate to replace all the lead service lines in 10 years. We can't have another generation of folks and families and kids dealing with an insane rule that takes super long to administer and is so complicated that EPA can hardly enforce it. So there's no accountability for violations, and compliance does not even equal safety. So you can get a letter from your utility right now under the lead and copper rule and say, oh, we're in compliance with the lead and copper rule, and it has no correlation to whether or not your water is safe. A new rule has to be honest with people. And if they're not going to be protective, they should say that so that people can take steps and get filters and things like that. So those are some of the things we need from a new lead and copper rule, and some of the frustrating ways that the existing one falls short.
Thank you. Colleen, I know there was some movement with a piece of legislation that you and the Lead-Free Promise Project have been advocating for. There was some movement yesterday, the 26th. Can you tell us about the bill and give us an update on its progress?
I'd be happy to, and I'm happy to be with everybody today. Looking forward to learning more from everyone. Yes, Rebecca. Yes, we're talking about Senate Bill 522 that called for increasing the number of children tested for lead in the state of Pennsylvania. And I imagine that many of you participating in this summit participated in advocacy on this bill. Ultimately this week, the bill that was put forward would call for children to be tested at least once before they turn 2 years old. It also called for the Pennsylvania Department of Health to launch a communications campaign to help raise awareness and education on lead poisoning and prevention and management. Yesterday, an amendment was added in the 11th hour that watered it down, that essentially made the bill reinforce practices that are already here. So it took out the requirement or the calling for a child to be tested at least once. And it described that a healthcare provider would assess the risk for a young child for lead and follow current CDC and American Academy of Pediatric guidelines. So essentially follow the guidelines that are already in place. And so this was a disappointing change to the bill in the 11th hour. And and that is the bill that did go through. So last night, the bill did pass through both bodies in the legislature. So the final step is for it to be signed into law by the governor. So it's from where I said, it's a mixed bag. So this bill won't go as far as we had hoped in helping to ensure that more children get tested. It will permit, more families will know about lead poisoning and prevention because of the communications campaign that the health department will do. The other concern about this bill, once we looked at it more closely, members of the Lead-Free Promise Project, because the bill was no longer calling for every child to be tested at least once, we looked at the bill closely because Allegheny County, it already requires all kids be tested. Same thing here in Philly, right? So local governments have power to call for universal screening. And when we looked at how the bill got amended, we're concerned that some local governments will now will not have the power to go forward with screening ordinances. And so we will look at that going forward as one likely amendment that we'll propose to this bill. So sorry, that took a little bit longer, but that's what happened yesterday.
Thank you. That's a good update. Thank you, Colleen. Councilwoman Strasburger, the Pittsburgh lead safety law passed a year ago now. Can you talk about the progress that's been made in implementing it and the challenges that have come with it?
Sure, I'd be happy to. So first, I really want to thank everyone for having me today. It's great to be back here at the Lead Safe Summit. And I want to call out the number of partners that helped to get this really comprehensive and complicated bill over the finish line. It's great to see Amanda here again today. She and her group were an instrumental part of this, as was Women for a Healthy Environment. So many local housing and environmental justice organizations here in Pittsburgh, and my colleagues, council members Bobby Wilson, Deb Gross, and former Councilman Corey O'Connor, who were co-sponsors of this and were really instrumental, along with our previous mayoral administration and current administration and staff. So in the almost year since this bill passed, I really have to give credit to the departmental heads who have worked really valiantly at implementing this. And in particular, our permits, licenses, and inspections director, Sarah Kinter, who really has taken the reins. It's almost like a passing of the baton. We've passed this. And I think many of us who were part of the coalition, both governmental and non-governmental, who made up the coalition of individuals and organizations, we convened as soon as this was over to say, okay, what do we need to do to keep, hold the feet to the fire? We know that in government, people get busy unless you're the squeaky wheel. You really, aren't expecting that people will have this at the top of the list. And I think what we found pretty quickly was we did divide into issue areas. Just to kind of recap, the bill is comprehensive. It does several things. It addresses the primary sources of exposure to lead, mostly in homes. So lead from paint, from dust, soil, and drinking water. It requires that lead-safe rental homes and child-occupied spaces have inspections through our Pittsburgh's rental registration program, which, as a side note, it's an incredibly important part of the bill. It has been in court. It has been litigated for the past 6 or 7 years. We were very hopeful that it would be implemented. The rental registration program, of which the lead safety law is a part, would be implemented this past May. And then there was a stay issued by the judge. We weren't able to implement it. So we're still hopeful that it will be implemented very soon. But that is a critical part of the bill. If lead is found in rental homes and childcare centers built before 1978, it must be remedied, and renters are protected from retaliation. There's a component around lead-safe demolition. So city-funded demolitions must have a lead-safe work plan. Lead-safe renovation and repairs. So all contractors or firms working in spaces built before 1978 must demonstrate that they'll complete their work in a lead-safe manner. And what that means is that really anyone who is given a city-issued permit for, I'm sorry, not a permit, but a license for various types of work in the city must have gone through the RRP training. And so we've been working to certify those different types of contractors. And then lead-safe drinking water, although our Pittsburgh Water and Sewer Authority had largely committed to replacing all lead lines and adding orthophosphate corrosion inhibitor to water lines already, and made significant progress. There was still the matter of ensuring that city-owned buildings, city-owned drinking fountains, and schools and child-occupied spaces in the city were also free of lead. So those are the components. I can tell you that, as I alluded to, it's fallen mostly in the category of permits, licenses, and inspections, our PLI department, to implement. And I have in front of me a punch list of about 20 different items that they have already completed. It's everything, I won't go through everything, but it's everything from performing research to identify which child occupied facilities are located in the city that are pre-1978 and communicating with those childcare centers and working to identify funding to help upgrade those systems as necessary. It's hiring new staff and inspectors, training 20 different inspectors on EPA certifications. It's holding, in partnership with Women for Healthy Environment, holding RRP trainings for all contractors who fall into the category of needing this to renew their permit, which was heavily subsidized thanks to Women for Healthy Environment. It's working to incorporate the lead law into our existing rental registration program so that when that is able to launch, it's ready to go. There are now over 1,000 PLI licensed general contractors in the city of Pittsburgh, so that's something that's already happened. The internal policies and regulations, rules and regulations have been updated. So, I mean, the list really goes on and on. The number of things that our Permits, Licenses, and Inspections Department has been able to accomplish with the leadership of Director Sarah Kinter. On the public works side, Public Works and our Director Chris Hornstein worked closely with PLI to identify which public-facing faucets and buildings were a concern when it came to lead lines, and there were only actually 2 that were identified as being problematic. So those are in the budget for 2023 to be retrofitted and replaced. And we'll continue working with PWSA to ensure that any lead lines, lateral lines, main lines leading to city facilities or drinking fountains are all retrofitted as well. As for the challenges, I think this part will be pretty quick. The challenges are twofold. One is there's when there's such a comprehensive bill that's passed, there's a need for funding. We were fortunate that this bill coincided with lots of federal funding coming through or being on, ready to be distributed. So with $20 million of ARPA funding that was already dedicated in last year's budget to lead, 17 million going to 17.5 million going to lead line replacement with the PWSA, Pittsburgh Water and Sewer Authority, 2 million dedicated to the implementation of this bill. It's a great start, but when it comes to what the work we actually really need to do citywide and then more importantly countywide, it's a drop in the bucket. So just the lack of resources that we have dedicated to this, it's something that comes up again and again, honestly, at the local level, when you work to implement something that's critically important, but it's either an unfunded mandate or it's our self-imposed mandate, but the challenge is falling on our footsteps to solve, and there's not necessarily the same support from the federal or state level governments. So that's why the work of others on this panel with me is so critical, and we're grateful for the support that has come in and the work that they're doing to bring additional support through federal dollars. The second is just the convoluted nature of local government. There are a lot of different departments, even within city government, that must implement this bill. And there are other levels of government at the county health department level, at the county, at the state DP level that are involved with this. So making sure that we're incredibly organized and deliberate and methodical about the way that we're implementing this and hitting the deadlines set out in the bill and doing it in an equitable way has been a challenge, but I think one that will be overcome. And now I'm sure that by this time next year, fingers crossed, we will have launched our rental registry program. There will actually be inspectors for the first time ever allowed to enter the inside of rental units to inspect for health and safety. Lead will be one of the items they inspect for, the presence of lead in paint, lead lines, in addition to other healthy home factors. I'm sure that will be its own challenge, is getting that off the ground and implementing that. So that'll probably be one of the challenges we hear from next year. Knock on wood, we're able to implement that at that time.
When you held a really unique position yourself, is you were one of the really big advocates for this particular policy. and you simultaneously held a seat on city council. So what was it like for you to engage in advocacy as a policymaker while being on the legislative body? So, you know, you were trying to lobby and advocate at the same time. What was that like for you?
Interesting. Yeah, I was an advocate on environmental justice issues for 9 years outside of government prior to joining government, first as a staffer and then as a member of city council. So it's interesting making that switch. I don't think the advocacy button ever, turns off, but you do have to walk the line of really just collaboration, bringing everyone together and recognizing the challenges that might exist within city government, whether it's budgetary or bandwidth challenges, addressing the concerns that might come from those who are closest to the issue, such as directors and deputy directors, listening to them when they say something won't work in one way or another, and then still working with those who are advocates like you, but maybe outside of government and want the strongest possible bill. And it's always a challenge, right? It's not, that's what they call it, sausage making. Legislation is like making sausage. It's not pretty to watch. And it's always going to be a challenge, especially when you have a lot of different people. And it's such a critical issue that we're talking about here. There is always going to be the desire to make the bill and the policies as strong as possible. And, sometimes there are limitations, and that's difficult as well. Is this the bill that we all thought we were going to be passing 2 years prior? No, it's not, but it's a really good start. And I think we can continue to build on it.
Thank you. So opening up to some panel questions, what gaps in legislation still exist?
Happy to jump in here. I think I mentioned a lot already in response to your first question, but I think they can really sort of be boiled down to two key themes from my perspective. And that's first and foremost, activities and policies that really help us find and fix lead hazards before kids are exposed and harmed, so that we can stop using kids as lead detectors. And then, as we've heard over and over again, the need for increased funding and more flexible funding that really helps us address these issues meaningfully and equitably in our communities. So, at the federal level, that includes things we've already talked about, like the increased investment in lead hazard control, banning partial replacements, funding full lead service line replacement, fixing that disclosure loophole that exists so that we can leverage the financing that's available at real estate transactions, enforcing RRP, lots more there. At the local level, I think it includes a lot of the things that, Colleen and Erica have addressed here, things like, proactively inspecting for lead hazards, better coordination for the entities responsible for different parts of this. So, how can water utilities and public health partner together more to provide a more holistic response to lead exposure, making sure those supports exist in the community that Erica was just mentioning. Like, it's great to have a policy, but are there funding sources available to help property owners who do need help, and making sure that everybody has access to them? Do renters have access to those sources as well to make sure that their properties are getting addressed? Doing simple things like embedding those RRP requirements into the local permitting process, lead safe demolition, right? A lot of these things that we have heard about so often, the workforce development issue that Erica mentioned as well. So there's a lot that can be said there. I'll share some links also to on sort of best practices for a lot of those policy. And then the final thing that I think hasn't come up here, and it's certainly important to sort of center children and keep children first and foremost, but we're also learning more and more about the impacts of lead exposure on adults, and really sort of thinking about that and how that may even impact the way that we think about the cost benefit of some of these policies.
I would add to what Amanda said on the local level. Last year when Pittsburgh was passing its terrific laws and being able to get into houses and inspect them, Montgomery County in Pennsylvania was doing something similar. Expressly, the borough of Norristown, they'd passed a similar ordinance, and actually took it another step in that when you go to sell your house in Norristown, you are required to have the property tested. And I was with folks in Norristown this week, and the code enforcement official, and he said, in the last 11 months, 1,000 homes have been certified as lead safe. In Philadelphia, right? It was done in 2011 and strengthened again in 2019, a similar lead certification law. And the Philadelphia Health Department announced this week that in the last 4 years, 82,000 rental properties in Philadelphia have been certified as lead safe. I'm definitely a proponent of local governments using their existing powers, and then even taking it a step further to strengthen those powers and modify the law. And then as a Lead-Free Promise Project, Rebecca and I and other folks work together to come up with an agenda, a legislative agenda. And it is definitely, Amanda, it's about money, right? And we were successful in April that we were able to secure $10 million from this Pennsylvania legislature in American Rescue Plan dollars. And we are going to continue to advocate for a permanent fund to find and get that lead out before a kid is harmed. And we've also on our agenda is a tax credit for families who can afford who pay to do the remediation, and they can get a credit back at the end of the year. And we are going to still, we're still going to keep moving on getting more kids screened. We weren't able to quite get done in this piece of legislation last night what we were looking to do, but I'm sure we're going to already we've already actually started talking about amending the law and finding administrative ways to get more kids screened, again, outside the legislature. So those are a few of the policy items that the Lead-Free Promise Project is looking at.
I can talk briefly about, just real quick, about some federal legislation. As you all know, not much passes these days. So the best hope is really just getting more funding, like folks have mentioned. Big bills have provided $15 billion for lead service line replacement, but depending on what estimate you use, that's either a third or a fourth of what we need. And then it's not passing legislation, but making sure that it gets to the places that have lead service lines is another thing. The vehicle for the $15 billion uses formulas to determine how much money each state gets. And the formulas are not necessarily in line with, which states have the most lead service lines. So right now you have a situation where EPA wants to get money to the states that have the biggest lead crises, but there's some difficulty in actually doing that. So there's some things that EPA can do, and perhaps Congress can do moving forward as they allocate more money to make sure that it gets where it has to go.
In this, just overall, protecting children from lead poisoning just seems like such a no-brainer bipartisan issue. Why is it so hard to get stronger legislation and regulations written?
Federally speaking, it is definitely a more bipartisan issue than other environmental issues, but that's a relative statement, right? Like that's like getting a D instead of an F. It's still an uphill battle, even though some, Republicans and moderates are coming around for legislation. That's what we saw with the infrastructure funding bill, right? That was a bipartisan piece of legislation because, most folks understand that this is a common sense issue that deserves support. For regulation, it's a little more tricky because the existing federal regulation that I described, the lead and copper rule and its reforms, have existed for over 3 decades. So there's just a lot of status quo, and this is just the way it's always been. And changing things up dramatically is really not the strength of the federal agencies or of Congress. So it's going to take EPA going out on a limb and putting their money where their mouth is and listening to folks like y'all who advocate before them, and a little bit less to other interests that are more interested in less restrictive regulations and things like that. So we'll see.
I would strongly agree with all of that, and just say, in addition just to there being a status quo, I think that there's also just this continuous education that's needed, that we haven't solved lead, right? Like, I think there was this idea for a long time, like, oh, we banned lead paint in 1978, we fixed it, right? And I think even, with some of what we experienced on the Hill the last couple of years was a lot of like patting themselves on the back for the $15 billion, right? Like, not understanding, has been pointed out here, that that's not fully funding even the lead in drinking water problem, let alone funding the lead problem, right? That it hasn't even begun to address the full spectrum and complement of lead exposure that communities are facing. So there's just this continuous need for educating. And I think once decision makers understand that and understand the like huge evidence base that we know how to solve this problem and the promise it has for return on investment, that's where we start to see support. But there's just this continuous need for education. And another thing that I think is worth mentioning, because it just is out there, is there can be this sort of zero-sum game mentality around these investments, whether we're talking about climate and health and sort of pitting that against each other, or housing affordability and housing quality, right? And that even though we're all serving the same communities and the same residents, there's sometimes some reluctance for folks who, may sort of come to this issue from different sectors to sign on to calls to action that prioritize health and safety alongside affordability, because there's this panic that there are these sort of finite resources. And I think also housing is a really complex and deeply personal ecosystem. So it's sort of different than investing in transportation or broadband or some of these other sort of more traditional infrastructure. So I think those are things that, all of us have to be aware of, but they're not insurmountable obstacles to our advocacy.
Yeah, just building off of what Amanda's saying, I think one hopeful trend I'm seeing a little bit is that more people who are running for office, who are being, who are elected to office, see problems in a more intersectional way than in the past. So I think we see slowly changing more people who understand that environmental justice is housing justice, is education justice, right? And they can wrap their heads around the need for policies addressing lead in housing and lead in water, and that it's all tied together. That said, I think that one challenge with this particular issue is that it's not as visible or tangible for as many people and as many constituents, as many residents, voters, whatever you want to call them, as some other issues are. So, as a local policymaker, as a local elected, by just pure chance and the way that these came together, I was the sponsor of both the Pittsburgh Lead Safety Act and a bill banning plastic bags in Pittsburgh that were passed in the same month. I'm really glad that my December this year is not going to look like my December last year. And I have to say that the plastic bag bill got 10 times the amount of public attention in terms of emails coming into our office and phone calls to our office than the lead bill. Arguably, the lead bill over time will affect and impact more lives personally, right? If we do this right, and more children's lives, more parents' lives and families' lives than banning bags, both important for different reasons and related reasons, but it was just something I noticed. And so I think that the invisible nature of this in a lot of ways is a challenge that we continue to need to overcome. And the education piece that Amanda mentioned is incredibly important.
Colleen, you're talking on mute.
Thank you. I would absolutely echo what Erica and Amanda said, and then I'll flip your question a little bit, Rebecca. You asked us, why is this so hard? And I'll flip it and say, what makes it easier is our biggest asset, which is us, right? We are our biggest asset. Between us all, we are smart, we are passionate, we are dedicated, we know people, we are strategic. And I just, seen it work over and over again when we work together and we identify challenges and who's going to block, and we, bring them on, or at least do our best defense. I think we're our best asset. And parents and a really wide variety of stakeholders. And and I get I'm really motivated by everybody, and again, look forward to making good new policy in the upcoming year.
I want to second that at the federal level as well. Like, a lot of the stuff at the federal level is very depressing, but the lead and copper rule and its reforms were basically the same thing for 30 years, and we have a chance to depart from that. And EPA has publicly acknowledged the disproportionate impacts of those two rules and the need for something different. Now we have to see how strongly they follow through, but there's a possible inflection point here with all the money allocated, which is more than ever for lead service line replacement. And then you're seeing in places like Pittsburgh and elsewhere more really important local implementation work. So there's probably been more change and movement on this issue in the last couple of years than in the last decade and change. Even here in DC, most people don't even realize that there was a gigantic lead crisis at the turn of the century. But nowadays, there's more people aware of that.
How else can we better incorporate environmental justice into our lead poisoning prevention policies?
My favorite answer to this question, I guess, is something that folks have touched on, is just bringing different movements together to build awareness about this stuff. Environmental justice is inherently a unifying, cross-cutting thing. So sometimes I work on water issues and lead issues with Latinx voting rights activist organizations. Like we can bring folks from different movements together to strengthen the support and to strengthen our advocacy. And historically, the environmental movement has been really siloed because a lot of people from these frontline EJ communities haven't been at the table. So, being more inclusive really makes for stronger advocacy.
I'll just strongly echo that. And so I think you're deeply listening to and amplifying the voices of affected communities. And I think coalitions, I swear this isn't pandering, like coalitions like this are the way to go. And we've seen that be, effective. And, two of the communities highlighted here today within Pennsylvania, and certainly in other communities around the country, doing really extraordinary work to really center equity and to also make tremendous impact. I'll call out, for example, our colleagues in Cleveland and the Lead Safe Cleveland Coalition, who are just blazing the trail, right, in terms of how they're equipping residents really to lead this work. And as a result, seeing tremendous gains. I think earlier this year, they passed the important milestone of raising $100 million for their Lead Safe Home Fund, right, from a diverse range of sources. So I think that's really important. There are also a number of tools, I think, which are being shared in the chat here, a report on achieving equity in lead policy and really learning lessons from the past about policy we thought was, it had good intentions, but maybe had unintended consequences, and really understanding those lessons learned, as well as, highlighting some tools from the Lead Service Line Collaborative, who recently just this week released a new suite of equity tools. And so for considerations of equity and lead service line replacement, really following on some work done by our colleagues at EDF, examining the consequences of probably well-intentioned policies to replace lead service lines, but that require owner expenses, and how that really just leads to lead service lines being replaced in whiter, more affluent areas. So I think we've just seen an explosion of sort of tools and resources and reflections, and so it's learning from those lessons and listening to communities, and coalitions are one of our most powerful tools to do that.
And I would also say that we need to be continually talking about the impact. Directly working with folks and talking about the impact. So in Pennsylvania, for example, most of the children currently who test positive are white, but there's a disproportionate impact on children who are Black and children who are Hispanic because they tend to live in properties where there is more likely to live in properties where there's deteriorated lead-based paint. So 4 times as many children who are Black and 2 times as many children who are Hispanic are exposed to are test positive for lead. So I think it's important to integrate, to be constantly talking and then again, all the things that Amanda and Julian also mentioned. And, you know, the Lead Free Promise Project still has, this is an area that we absolutely can do better in growing the coalition, specifically around environmental justice.
And I'll just add that on top of everything we've already heard, like one very specific implication of building a big and diverse coalition isn't just in getting the bill passed or the policies implemented, but it's when the money comes in, when there is money to distribute, it's then overcoming that barrier of the money, the people with the most means and the most privilege and the most ability to access the funding, always getting the funding because they know about it, right? Like if you have the diverse coalition built into from the beginning, you have those partners who can ensure that the money that is available for childcare center upgrades or rental upgrades or home upgrades are that those who are the least likely to know about that funding then have access to it. So just as a sort of real life example that we're seeing on the ground right now.
Great. Thank you all so much. Do any of you have anything to add before we wrap up our section today? All right.